Stop smoking. Your health and well-being is important to all of us. Today, your healthcare provider has requested that you watch this brief video. Are you a smoker? Do you live with a smoker? Were you a smoker in the past? Are you frequently out of breath? Do you have a frequent cough? Is your voice raspy? Is your skin aging faster than you are? Are your teeth discolored and are you suffering from gum disease? Smoking is a hard habit to break. The drug found in tobacco is nicotine, a substance considered as addictive as heroin and cocaine. Withdrawal from nicotine is both physical and mental. Symptoms of nicotine withdrawal include dizziness, irritability, depression, difficulty sleeping, restlessness, headache, and increased appetite. Cigarette smoking is the leading preventable cause of death. Over 430,000 people die each year from smoking-related diseases, and health care for smoking-related illness costs over $97 billion each year. Smoking leads to heart disease, circulatory disease, from blocked arteries in the legs to strokes to erectile dysfunction, lung disease such as emphysema, and chronic bronchitis pulmonary disease. And cancer, not only to the smoker, but also to those exposed to the secondhand smoke. In fact, almost 90% of all lung cancer is related to smoking. The Surgeon General now lists pneumonia as a disease caused by smoking. Smoking has also been shown to be an independent risk factor for causing lower back pain. Smokers who may have back surgery also have significantly worse surgical outcomes than non-smokers. There are a number of different factors why smokers are more likely to have low back pain, ranging from lack of oxygen to the tissues to slower recovery from an injury. If you smoke, you have a higher risk for developing back problems. Smokers are twice as likely to die from a heart attack as non-smokers. Smoking also increases the risk for developing macular degeneration, a cause of blindness. And don't forget about the effect of smoking on your skin. Smokers tend to look 10 years or more older than they actually are. Women who smoke and take birth control pills are at a very high risk for developing strokes, blood clots in the legs, and heart attacks. Women who smoke while pregnant are at a higher risk for miscarriage and for having a low birth weight infant. And parents who smoke put their children at higher risk for developing asthma, particularly if the mother also smoked during pregnancy. In the 1990s, the Center for Disease Control found that male smokers died an average of 13.2 years sooner than non-smokers, and female smokers died an average of 14.5 years sooner than non-smokers. More than 10 years is cut off your lifespan if you smoke. As soon as you quit smoking, your circulation begins to clear, your lungs begin to clear, and breathing becomes easier. Your sense of taste and smell improve, and your blood pressure may start to return to normal. The U.S. Surgeon General's report tells us that within 1 year of quitting smoking, the risk of heart disease is half that of a smoker's risk for heart disease. And 10 years after quitting, the risk of lung cancer is less than 1/2 that of a smoker's risk. 15 years after quitting, the risk of heart disease is the same as someone who never smoked at all. Within 12 hours after quitting smoking, carbon monoxide levels in your blood drop back to normal. Within 2 weeks after quitting, circulation and lung function both improve. Quitting requires willpower, commitment, and a support network. It's up to you to provide the will to quit and the commitment to stick to the treatment program. Some of the treatment options for quitting smoking include herbal remedies or natural remedies, such as Avena sativa or oat extract, medications, nicotine gum, smokeless cigarettes, hypnosis, meditation tapes, auricular acupuncture, and an online smoking cessation program given by the American Lung Association. Visit www.lungusa.org to learn more. There are many ways to stop smoking, but it's your choice to decide when and how you will do it. Your healthcare team has a star player, you. Working together as a team, you and your healthcare professionals can decrease the likelihood of future problems associated with smoking. A better quality of life is the wellness goal to better health. With the help of stopping smoking, you're on the right path to achieving that goal. If you have additional questions about the information provided, please ask your healthcare provider or front desk staff for assistance.